ACMC segment of the show, always on second, usually every other Tuesday. And joining us this morning is Loreen Ibala, who is a nurse practitioner at Ashtabula Clinic. Is that correct?
That is correct.
How long have you been there?
I have been there for 6 months.
6 months?
I'm new to the area.
Oh, really? Where are you from?
I moved from New York City.
New York City.
We wanted to get outside of the city and live in a little more rural area. I grew up in a rural community.
Yeah.
So I spent 10 years in New York City. My husband and I, we just recently got married and we have a child, so we wanted to get outside the city and raise our child in a little more
Good for you.
rural area.
It seems like there's a lot of people that come from the big city at your hospital that seem to enjoy the rural atmosphere that we have here.
You know, I actually grew up on a farm.
Did you really?
I grew up in agriculture and we raised a lot of animals. So I went from that type of setting to the city, which was
What was it like
amazing.
living in New York? I've only been there one time, and that was a long time ago for the New York State, what was it, the New York World's Fair in '64. It was 1964. I was just a little kid, and I love New York City.
It's amazing. It's simply amazing. It's very, very fast, and you get to do a lot of cultural things. There's an amazing mix of cultures.
There's a big mix of that, isn't there?
It's amazing. And it's so...
What about travel, though? I mean, that would drive me crazy. You have to get in taxi cabs all the time. And...
I actually had my own car.
Really?
I did.
And you had to drive in that traffic?
I did.
Lord.
And I got to be pretty good. And it was a good experience.
Really?
But after 10 years, we decided we wanted to live more, again in the more rural community.
Big difference then, right?
It is.
Yeah.
It is.
Do you have a farm here? Or?
We do not. We hope to at some point in time.
Yeah.
We moved in the end of July.
Okay.
So we're renting for now and looking around in the meantime.
Good for you. Well, welcome to Ashtabula County. That's a
Thank
great
you.
thing. Now, you are a nurse practitioner, and what's the difference between being a nurse and a nurse practitioner?
Okay. A nurse primarily takes orders from physicians. As a nurse practitioner, we went back and got extra schooling, and now we're allowed to diagnose and to prescribe medications and treatments. As a nurse, you're allowed just pretty much to take orders and to carry them out.
Do you work for a certain doctor there, or do you? I mean, how's that work? Now, forgive me for being naive. I don't know how this works. Do you have a doctor you work with specifically there, or do you have your own little practice? How's that work?
So I do work in the family practice clinic. I do work with Dr. Choi and Dr. Lee.
Oh yeah, okay.
If you're familiar with
Yeah,
them. Yes?
yeah.
Okay. I do have my own patient load, and if I have any questions, I will consult with Dr. Lee and Dr. Choi.
Mm-hmm.
In addition, I do see some of their overflow patients, like say if they have cold, sinus infections, simple things like that. I will see them for Dr. Lee and Dr. Choi.
So, like, if I came to your clinic and I got you as a practitioner, you could actually prescribe drugs
Absolutely.
or medications.
Absolutely.
Yeah,
Mm-hmm.
that's great. That's good. Which I don't know. I just learned about practitioners within the last 6 months or so. I guess I had another one on. I had no idea that was available, and it probably helps out these doctors that have a big caseload.
Actually, it's a problem nationwide. We're facing a national shortage of physicians. You know, half of the doctors are reaching older age and are looking at retirement, and there's not so many young people going into medicine anymore. So,
right.
And with the national health care laws, everyone getting insurance, we're facing a lot of new people coming to seek medical care, and it's just overwhelming for the physicians that are already working. So what they've done is give the nurses extra training, so we'd be able to fill in some of those gaps, and we can do some of the basic things.
Is that what you did in New York too, as a practitioner?
Correct.
No kidding.
I worked as a nurse. I did my schooling in New York City. I practiced there for a year and a half, and then I moved here.
Okay. I imagine it was pretty busy, I would imagine, in New York City with patients.
It was.
Yeah.
It was.
I can't imagine.
It's everywhere you go.
It amazes me when I hear people that move here from the big city, because when I was a kid, that's where I wanted to be. It's New York City or California. But now that I've gotten older, I like this kind of lifestyle. You know, I feel more at home with it. I mean, you have 5 traffic lights here. You know, that's nothing like you would have in New York City. You know, at all.
There's good and bad in both, and unfortunately, you can't have both of them in the same.
Exactly.
So you have to pick and choose.
Exactly. What additional training did you have to receive to get this position?
So after I had my registered nurse degree, I had to go back and get my bachelor's degree, which was 2 years, and then after that, I did spend 2 more years in schooling for my master's degree, and that includes like an additional 500 hours of clinical experience under a physician's direction or a nurse practitioner direction, where you're actually diagnosing and prescribing medications under their direction.
Okay, so you have masters.
I do have a master's, and then you have to pass national board exam.
And you said, how many years did you have to go to school for that?
I went for school probably 6 years.
Total. 6 years. Okay. Okay. What are some of the type of illnesses and injuries that you can treat and do treat?
The most common ones are hypertension, high cholesterol, diabetes,
Blood pressure.
and COPD, correct. Those are the most prevalent problems in our communities. Those are pretty basic, and those are things that I deal with pretty much on a daily basis.
Can I ask you this? We've had a terrible winter here. A lot of people falling down on ice and stuff. Do you get any of that stuff?
Yes.
Do you really?
Yes.
Yeah, but
Especially lower back injuries from falls.
do you really?
Yes.
I've noticed from, and I think it's from the up and down weather, the cold one day and freezing cold, and then it gets a little warmer. I've been kind of nursing up being stiff and stuff, and I don't know whether it's the weather or not, but I think that's what's causing that. We've had a lot of reports of people falling on ice too, and I'm concerned about that because I certainly don't want to break a hip at this stage of the game.
Absolutely not.
You know,
Absolutely not.
have you had any breaks like that? Any broken bones or anything?
They would see those primarily more in the emergency room. I haven't seen any in my own practice.
No.
No. So if you fall and you're injured, you typically go to the emergency room and diagnose.
Normally you would go to the ER and get it taken care of immediately.
Correct.
Yeah. What are your hours like? Are you there Monday through Friday?
I'm in my office Monday through Friday from 8 to 3:40.
To 3:40.
Yes.
Okay. Okay. I think you mentioned this, but I'm going to ask you this anyway. The physicians you work with are Dr. Lee and Dr. Choi. Was Dr. Choi the one that retired and came back? Or is that Cho?
That was the cardiologist.
Cardiologist. Yeah.
That was Dr. Cho.
Okay. And you mentioned that you also have some of your own patients, which I find is amazing because you're basically, even though you don't have the title, you're basically a doctor, even though they call you a nurse practitioner, because you can basically do anything that a doctor can do.
Well, the amazing thing about medicine is that there's been so many advances in the knowledge of medicine, and we've been able to specialize in so many different things. So if you think about it, we now have like rheumatologists, and we have cardiologists, we have pulmonologists, and we have pretty much a specialist for every part of the body you can think of, which is amazing. However, it's also fragmented healthcare in a lot of ways, in that, because there's no way one person can know everything about every part of the body.
Right.
So I deal with primary, the basic things, and if there's anything that looks like a specialist might be able to give better care, we have specialists in our facility that we get them to. So like, for example, if you're a smoker, chronic obstructive pulmonary disease, you're not controlled on albuterol and your Spiriva, we go ahead and get you to a pulmonologist. We'll do further testing and better treatment, which is perfect. We do the basic things, and then after that we do have other options.
Back in my day when I was a kid, doctors would come to the house and treat you. Of course, they don't do that any longer, but
they actually do.
Do they really?
We actually do have 2 providers in our facility right now that will actually come to your house.
Really?
We do.
Yeah, that was the big thing. But like you say, in those days, and I'm talking back in the 60s, 50s and 60s, when we were just kids, but they didn't have these specialists. I mean, one doctor took care of everything. It was like the country doctor type thing, you know, if that makes any sense.
It absolutely does.
And my doctor was Dr. Brown, Dr. Walter E. Brown, and he was from the old country, but he was a specialist in every field that, you know, that we relied on him. My whole family did, and a lot of people in this town did, and took care of a lot of different illnesses, and that's how we grew up. But like Loreen says, today, if somebody comes to them and they think they may have a little heart problem or rheumatoid arthritis or something, there are specialists out there now available that can take care of you. And we just didn't have that back in the day. That's amazing.
We didn't, and yes, it is amazing because the options are so much better.
Mm-hmm. Oh, definitely. And your chances of survival are a lot better.
And yes, it's true. You know, I'm seeing 90-year-olds. They're very healthy. They're getting around. They're living a good life. Yeah. And years ago, that was almost unheard of.
It's amazing because you know, years and years ago, the life expectancy was in the 40s and maybe the 50s. Now, as you mentioned, you have people living into their late 80s, into their 90s,
and very healthy.
And very healthy, and still driving and getting around. I think that's wonderful, you know.
Absolutely, and that's our goal for everybody, is to live a long, healthy life.
Right, right. Now, you've only been at ACMC for about, what did you say, 6 months? 6 months. Now, if people want to get a hold of you, I'm going to send this number out, if it's correct. The Ashtabula Clinic, I have 992-4422.
No, our direct family practice number is 440-997-6910.
Okay.
I have it here also.
Oh, okay.
And that will get you directly to the family practice, so you don't have to make so many phone calls.
Now, the clinic, is that the one, is it across the street from regular ACMC? Is that, I'm not familiar.
When you go into ACMC, you have like the part with the hospital.
Right.
Now the family practice is the door to your right, and it has like an entrance.
Now, I've only been there a few times.
Okay.
Okay. Mm-hmm. And there's a entranceway.
There's actually 2 of them.
Okay. The one I go. You drive in from I don't know my streets there, but you drive in, park your car, and then you go in. There's one on this. There's one on the north side, and the one I'm thinking about is on the south side of the building.
Enter the south side.
South side. Okay. That's where
the family practice would be.
Okay. Gotcha. Excellent. I think this is great. We really want to welcome you to Ashtabula County. I think it's so neat to have people come here from the big city and appreciate what we have to offer. Did you get to spend any summertime months here yet?
We arrived in July.
Oh,
so we did.
So you did.
We came right in the summer.
Yeah, you did. We had a pretty nice summer. About then, I mean, it was kind of a late summer for us, but unfortunately you got stuck with this winter. But if you're from New York, you know what winter can be like.
Absolutely.
You put up with it before. Now, if you would like to get a hold of Loreen or her office staff, the number to call, correct me if I'm wrong, Loreen, 440-997-6910. Is that right?
That's correct.
Okay, 997-6910, and she will be able to treat you for a variety of different things, colds and flus and all that sort of stuff that's going around. Have you seen a lot of that going around, that flu stuff?
Our actual community has been very fortunate. I have seen some of the flu, but there's only been 15 cases of admissions in Ashtabula County for the flu.
No kidding.
Which is amazing.
Because over in Erie, they were having a terrible time over there.
And Cuyahoga County had 553 admissions.
Really?
So right here in Ashtabula, it seems like we're doing good.
Yeah, I
I
guess.
have seen some flus, but it hasn't been so severe.
I had a case of it here a couple months ago, and the thing did not want to go away. I think I had it for like a month, and luckily it went away. But it hung around. It luckily didn't get too bad where I had to get admitted or anything like that. But it was just something that I picked up somewhere. And I guess the bottom line to keeping this away is to keep your hands washed.
Absolutely.
Yeah.
Good respiratory hygiene, that means disposing of your tissues, good hand washing. If you cough, sneeze, cover your nose and your mouth and make sure that other people around you do, because if they cough and sneeze, it's usually transmitted through respiratory droplets.
Yeah, my wife, when I got sick, I would just break out with a sneeze, and she goes, "Will you please cover your mouth, because that travels like 6 foot or something."
Correct.
That way." And,
She's
and
absolutely right.
she knew exactly what she was talking about. So
Correct.
now I have to be very careful with that. Loreen, I want to welcome you and your family to Ashtabula County, and please come back and see us. I know you were a little nervous coming on, but it wasn't that bad, was it?
No,
See, I told you it wouldn't be bad. Thank you so much for coming in.
it was a pleasure. Thank you.